Welcome to Reducing Risk Factors for a Second Stroke. My name is Eileen Gornell. I'm the stroke coordinator at the Valley Hospital. Thank you for joining me to learn about what you can do to prevent stroke. Every year, about 800,000 people in the US have a stroke, and stroke is a leading cause of disability. Something that's very concerning to me is that many stroke survivors go on to have another stroke. So what is a stroke? Well, we call it a brain attack to emphasize that this is a medical emergency. A stroke occurs when the flow of blood to the brain is either blocked or the blood vessel bursts. Brain cells in the affected area are damaged, and this part of the brain may no longer be able to function. There are two types of stroke: ischemic or clotting stroke and hemorrhagic or bleeding stroke. Ischemic stroke is the most common type, making up about 85% of all strokes. Ischemic stroke occurs because of a blockage in blood flow to the brain. This blockage prevents blood and oxygen from getting to an area of brain cells. A hemorrhagic stroke is what happens when a blood vessel tears or bursts. It's important to know which type of stroke you've had because the risk factors and causes for these different stroke types are somewhat different. Here are the most common risk factors for an ischemic stroke. See which ones of these apply to you. The most common risk factors for patients we see here at Valley are sedentary lifestyle, obesity, high cholesterol, and high blood pressure. The good news is that these conditions can be managed to significantly reduce your risk for stroke. Hemorrhagic stroke risk factors are a bit different, but also include high blood pressure, which is the most common risk factor that we see. Most Americans don't get enough exercise. If you don't have exercise built into your routine, start small. Even walking for 10 minutes each day can make a difference. Think about the types of activities that you enjoy most. You're most likely to stick with a routine if you involve your friends and family. Consider creating a plan to exercise regularly with someone you want to spend time with. Setting realistic goals for healthy body weight is important if you are overweight. Even losing a few pounds can improve your health. So know where your body weight is and know what your goals are. It's best to be specific, like I will make lifestyle changes which will help me to lose and keep off 3 to 5% of my body weight. It's important to understand how much and why you eat. Keeping a food journal can really help. This way, you think about how much you're eating and when you're eating. Even doing this for a few days can gain insight into your eating habits. It's also valuable to manage your portion sizes. Smaller portions can help prevent you from eating too much. Making smart choices is important. Think about choosing nutritious foods over foods that are high in sugar and fat. Simple substitutions mean that you can enjoy snacks without eating a lot of unnutritious foods. And we talked before about being physically active, with our goal being to aim for at least 150 minutes of moderate activity every week. High cholesterol is one of the major controllable risk factors for stroke. Cholesterol is not inherently bad, but too much cholesterol contributes to a higher risk of heart disease and stroke. So talk to your doctor about what your total cholesterol and LDL levels are. If you have high blood pressure, make sure that you check your blood pressure regularly and follow your doctor's instructions. Write down your blood pressure and bring it to your doctor's visits. This will help your doctor to know if your medication is working. If you're concerned that you may be experiencing side effects of your medications, don't just stop taking them. Contact your doctor and see what can be done. Perhaps your medication dose can be changed or you can be switched to a different medication. If you're diabetic, check your blood sugar regularly, write it down, and bring it to your doctor's visits. This helps your doctor to know if you're on the right medication. Even if your readings are normal, don't stop taking your medication without speaking to your doctor. Ask your doctor about your hemoglobin A1C levels. These levels can give a good sense of how your blood sugar has been controlled over the past 3 months. Find out if you have atrial fibrillation. Atrial fibrillation is a heart abnormality that's a serious risk factor for stroke. If you've had heart monitoring while you were in the hospital, or you've had a sticker and patch monitor after the hospitalization, or if you've had an implanted loop recorder, all of these are ways to check your heart rhythm, and your doctor's been looking for atrial fibrillation. Some people have this heart rhythm problem and have no symptoms. It's possible to have normal heart rhythm most of the time and to still have periods of atrial fibrillation that can increase your risk for stroke. If you have atrial fibrillation, your doctor will talk to you about the importance of taking a blood thinner medication for stroke prevention. Obstructive sleep apnea is a condition in which breathing is interrupted repeatedly during sleep. It's usually characterized by daytime sleepiness, loud snoring, and episodes of breathing pauses or gasps. Sleep apnea is common in stroke patients, and if it's untreated, it can negatively affect recovery. Diagnosis and treatment of sleep apnea after stroke is important, as having sleep apnea increases their risk for future stroke. Risk factors for sleep apnea include obesity, large neck size, high blood pressure, airway abnormalities, and family history. Blood thinner medication can increase the risk of bleeding in the brain and lead to a hemorrhagic stroke. But these same medications may be necessary to prevent an ischemic stroke, especially if you have atrial fibrillation or a blood clotting disorder. If a blood thinner is prescribed for you, take your medication regularly and carefully review the information about anticoagulants that you receive from the pharmacy. Antiplatelets are another class of medications that are commonly used for stroke prevention. These medications are not true blood thinners, but they keep blood clots from forming by preventing blood platelets from sticking together. They can help prevent ischemic stroke and also heart attack. Aspirin is the most commonly prescribed antiplatelet medicine. Some patients are prescribed 2 antiplatelet medications to be taken together for up to 3 months. Anticoagulants, which are true blood thinners, delay the clotting of blood. They're used to prevent ischemic stroke in patients with certain health conditions like atrial fibrillation. People with high cholesterol are often prescribed medications to help lower their cholesterol. The most commonly prescribed cholesterol-lowering medications are called statins. Statins disrupt the production of cholesterol in the liver, causing less cholesterol to be released into the bloodstream. Statins also reduce the inflammatory process caused by elevated blood cholesterol within the blood vessel walls. Taking blood pressure medication and diabetes medicine as prescribed also reduces your stroke risk. Create a routine to make sure you don't miss medication doses. Use a pill box with days of the week and set an alarm on your phone to remind you to take your medication. Make sure you always have at least a week's supply of medication ready so you don't get caught without a refill. You probably have more than one doctor you go to, and it can be a lot to keep up with. Bring a notebook with you to your appointments to keep track of questions you want to ask and when the doctor wants to see you next. We want to help our stroke survivors do everything possible to prevent a future stroke, but there is no guarantee. So it's important to be knowledgeable about the symptoms of stroke to look out for. Remind your friends and family that common symptoms of stroke include facial droop on one side, arm or leg weakness on one side, speech difficulty, and that if they think someone might be having a stroke, they need to call 911. Thank you again for joining me. For more information, please check out the resources on our Stroke and Aneurysm Support Group website.